Good afternoon. Welcome to the President's Message. Today we're going to talk about the return to campus plan that everybody has been anxiously awaiting. Dr. Bates, thank you for joining me. You have chaired the COVID-19 team and been a key instrument in helping get this plan to the point that we're ready to share it today. So we're going to just, thank you very much.
Glad to be here.
We're glad to share this, and then all questions, direct them to Dr. Bates.
Absolutely.
No, we are welcome to share in all of that. So I want to just begin by going over the guiding principles that, as this plan was developed over the last 2.5 weeks or so, 3 meetings with the Return to Campus Committee, that the guiding principles have always been to maintain the safety of our students, our faculty and staff, and other stakeholders. And we have talked about that many times. We also want to make sure that we are minimizing any health risks. And so you will see that communicated here in the plan. And also it's been really important to follow government requirements, guidelines. And I just have to compliment Dr. Bates. He has read many materials that have communicated, and they have sometimes changed. So while the plan may have started out in one direction, the guidelines that we're following are what are the most recent and relevant to the plan today. Dr. Bates, one of the things that is a key center point of our plan is that we are going to be identifying all of the programs and services and operations of our institution in various categories, because that makes a difference in when they would be brought back to campus. And I do want to just give an overview here to remind people that throughout the summer, our courses were moved to online, and so that online learning is continuing. However, there are some key components of courses that, as you talk about these categories, are having to occur back on campus now. The goal is to bring individuals back to service and operations as fully as we can following this plan beginning in August, and it's Monday, August 3rd is the date that we're shooting for. So talk about these categories and how that will impact the programming that we have on campus.
Thank you, Dr. Anderson. So as the team worked together, we initially envisioned a phased-in approach where there are some things that we do that we just have to do on ground, and those things would be the priority to get on campus first, and then we would work on towards that. And so that concept evolved into our categories that we have here on the screen. So Category 1, Category 2, Cat 3, and Cat 4. Autumn Porter likes to use the Weather Channel lingo, Cat 1. So Cat 1 programs, services, and operations are those that require full or parts of the programs on campus to meet those outcomes. So from the very start of the pivot, we've had on-site essential programming. We had things going on campus, very limited, but there are some things that you have to do on campus, like take care of the heating and cooling system, or mow the grounds, or it could be a welding laboratory, or some things like that. The outcomes can only be met in an on-campus situation.
The mail.
So the mail room, yeah. So a Cat 1 program, service, and operation, it may be the full program, or more likely it's just a piece of a program, a part like the welding program. Part of the welding program, the didactic part can be delivered online perhaps, but the welding instructors tell me that unless you feel the sparks flying against your legs, you can't learn welding. So you have to have a piece of that program, the lab part of that program, on ground. So that's an example of a part of a program that would be Cat 1. Cat 2 programs, on-campus programming is enhanced by being on ground, but it's not required. So some things are better if you could do it on ground, but we could do it online, but it's just better on ground. So, for example, we're considering tomorrow a request for computer labs to be open to help support our summer online students. So we have some limited access, meeting all the criteria, limited computer labs open to support that. That's a category 2. They're proposing that as a category 2 because it's not required. We don't have to have it, but it sure enhances our programming if we could have students to have access. Most of our programs and services and operations are Cat 3. Those Cat 3 programs can be delivered just as effectively online or on campus. And then Cat 4 programs and services, that programming maybe is on the very fringes of our mission and can be delayed until COVID-19 is no longer a risk. For example, many of the recommendations are that you shouldn't bring in large community groups for large meetings onto the campus. So though that is part of our mission, being responsive to our community and having that opportunity, it may not be as central to our mission as a psychology course or financial aid program or the maintenance department. So, so that is an example of a Cat 4 program. So we envision a process where we work together with the members of the executive leadership team, work with their direct reports, and either the ELT member or their designee will meet with every employee in their area to discuss their programming, whether or not it's a Cat 1, Cat 2, and make some declarations of that process. So that's kind of the starting point for us.
Okay, and I just want everyone to know that ELT members have been charged to complete this exercise by June 5th, and we will be categorizing and putting that into a smart sheet so that we can talk about that in the COVID team as well. These are recommendations from ELT as they work with the individuals in their various areas. I do want to point out in category 2, it says it enhances programming but might not be required. I think that's an important distinction because while we have people working online and at home, perhaps that they would be truly more effective and enhance that work if they could be back on ground. And I know that as you visit with your ELT member, the folks that are watching this, talk about that because we want to make sure that we get these in the best categories that we can and quantify those operations. So it might not just be academic programs, obviously services and parts of services that we are quantifying that way. You know, the plan that you will read, and it's a 7-page plan. We do encourage you to read the whole plan, think about it, read it again, and then when your ELT member calls to talk about the category that your program service is going to be in, you can at that point in time ask questions because ELT has had a chance to look and review the plan on Tuesday to make sure that we are all on the same page. So the plan talks about obviously getting our programs and services categorized and then the safety requirements. We want to ensure again that we are keeping individuals safe. So there is physical distancing that we know is the recommendation from all national health experts and including Pettis County Health Department, Joanne Martin, that individuals maintain that physical distance to remain safe. So that is discussed in the plan, and you can see that we are working with facilities to make sure that physical distancing is outlined and probably marked on floors and other spaces throughout campus so that students, faculty, and staff are reminded to keep space between themselves and others. Another part of the plan talks about the health. Obviously, if you are not well, we don't want you coming to work. So first and foremost, if you are exhibiting any of the symptoms of COVID-19 disease, and they are listed here on the screen, but also in the plan. We want you to be home. Now, that may mean you get to work from home until you are identified as, well, or if you're remaining to be sick. So we will continue to monitor that. So that is also included in the plan about your health. Then, Dr. Bates, you want to talk about the other pieces of protection and education that individuals are going to read about in the plan.
So other parts of the plan include, so especially if you can't have, if as a safeguard for physical distancing, masks are recommended. Oh, Dr. Anderson has her masks. They're ready to go. Today, the deans and Dr. Anderson and Justin O'Neill and I toured the campus. We all had our masks on. And so those masks, though, you see people in the community, some people wearing them, many people don't. They still are strongly recommended. And it's really a protection. I wore my mask to protect Dr. Anderson from me. And so I think that's an important point to think about. We're going to get through this, and we're going to do well with this, but it's about our culture. And so we have to have a culture where we take care of the health and safety of not just ourselves, but those around us. And one way we can do that is by wearing those masks. And so they're going to be recommended. We're going to provide masks to all employees and to all students so that they can use that. We know some people have trouble wearing masks, so we'll have to work through those processes, but those masks are strongly recommended. There may be personal protective equipment that may also require depending on the job. So we may, in some places, have public-facing desks that we need to install the plexiglass shields on. So a lot of this isn't going to be new to you because, if somebody's been out in the community, if you've been to Walmart, there's social distancing things that are recommended in Walmart in terms of, walk this direction and stay this far apart and those kind of markings in place. So, so we'll be doing the same kind of things. In addition to that, before people return to campus broadly in August, we will have training for all faculty and staff and for students. So before you return to campus, we'll have some brief but informative training sessions that everyone will go through. So we're all on the same page. We know what the expectations are and can proceed in that way. An important part of our protection is our facilities and the sanitation process. So Justin and his team have been working really hard to make sure our facilities have been sanitized while most of us have been away. And so they've gone through an extensive process to ensure that, but then they're putting in place other processes. But the thing about it is it's going to be, that's too is going to have to be a team thing. So there is no way that we have enough staff to clean every flat surface after somebody has touched that flat surface. So we may need to, we will be providing some materials and training to faculty, staff, and students to help clean up the workspaces. And so that'll be part of the plan as well. One of the really challenging parts is the residence hall students. The residence halls, we have strong interest again this year, record applications for our residence halls, which is a great sign for our enrollment. And so Charles Howell is working with Dr. Porter to develop a plan to help us to make those residence halls safe for students. He's consulted with the National Organization of Residence Hall Directors, and he's also collaborating with a group of other residence hall directors here in Missouri Kind of fortuitously, they kind of spontaneously formed a group of community college residence hall directors right before the COVID hit. And so that group had a structure and already started meeting. And so they're they meet just about every week or about every other week to share ideas and to share what they've learned with each other. So Charles and Autumn are working hard on that plan. So finally, the increased awareness, again, it's about that culture on our campus. We have to acknowledge that it's not, we're going to return to campus, but it's not really business as usual. We're going to have physical distancing requirements on campus. We're going to have increased sanitation protocols. Most of us will be wearing masks. We will have other PPE available. If we're sick, we're going to stay at home, and we're going to pay attention to our health and be real alert to that. And by doing these things, it's going to change our culture into one, and I shouldn't say change, it's going to ensure that our culture is one that we're really fine-tuned into the health of our campus, so we can accomplish our goals and exit this, kind of dark period, continuing to meet the mission of the college.
So you can see on this slide, the plan is available. It's available through the COVID-19 website, but it'll have its own landing place. We hope if you're viewing this video that you will go get the plan, read it, and I want to emphasize again to each of you, we care about your health and safety, and this team has worked so hard to put many details in this plan to ensure as best we can that your health and safety is maintained. We have had our legal consultants go over the plan with us, and they made a few recommendations, but they really did complement the work that the Return to Campus team had put together. The plan has also been reviewed and approved by the Pettis County Health Department, and the individuals on the team took this so serious and wanted to make sure that everybody was doing their part. So as you listen to us now and as you read the plan, please understand that we would like to be back to normal, just like it was before, where we could, be friends, shake hands, hug people as appropriate, but it's not going to be that way, because until this pandemic is over, we need to do those things to keep ourselves and each other safe. So as Dr. Bates said, he's wearing a mask to protect us, and I'm wearing a mask to protect you. And that's not in our culture. So you are so right, Dr. Bates. Our culture and the way we have to think about things is changing. The one thing that is in our culture, though, is caring about each other. And this is a place that has always been caring about our students, caring about each other. And Mark Haverly says it all the time in our leadership meetings that he loves the culture of State Fair Community College, as do we, because it's a caring institution and we value our people, we listen to them, and we want to hear what they have to say. So thank you so much, Dr. Bates. For you, I compliment the whole team that has worked really hard putting this Return to Campus plan together. We want you to read it, to think about it, and call Dr. Bates, call myself if you have questions, but more importantly, your executive leadership team person will be visiting with you about the plan, and as we categorize these programs. Again, we want to see individuals on campus safely when we come back in August, provided things don't change again. I mean, obviously this plan, the last thing we want to say is that it's potential this could change. But this is the best information that we have available to all of you right now. And Dr. Bates, any last words? Thank you so much.
Well, I do think that that's an important point, Dr. Anderson, to emphasize that this will change. I mean, the guidance changes daily. And as new science comes out, new recommendations come out. So, we're going to we're going to be, that's what community colleges are about, being agile and being able to move. And so, you know, I quoted several times Dwight Eisenhower's famous phrase to admonition to plan, 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 and then change the plan. And so that's what we're doing. We're planning, 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 and it'll change. We'll change the plan to react to the moment, but our guiding principles are going to be there through the whole thing, maintaining the health and safety of our campus. So.
Thank you. Well, in closing, please read the plan. Again, if you have questions, contact your executive leadership team, dean or director, and or call Dr. Bates or myself. We're glad to visit with you. Thank you for joining us today. Read the plan.
Yeah.